skin cancer, and prevention and treatment is my niche, my passion. But I do everything. If you have rashes, eczema, I see kids, I see anything. But if you need my expertise, it's on skin cancer. Real estate, your nose, your face, your ear. It is easier for you and easier for me to treat it when it's the absolute smallest that it can be.
Can you get sunburnt with the window up? That's actually a legitimate question. Hey guys, my name is Ken Clark, owner of Purpose Physical Therapy and host of the St. Petersburg Professional Spotlight Series. Today, I'm honored to sit with somebody whose expertise and impact in this community truly stands out. Dr. Weston Wall is a double board certified dermatologist and a fellowship trained Mohs surgeon and founder of Wall Dermatology here in St. Petersburg. Born in St. Pete, Dr. Wall and his wife created their privately owned practice with one simple but powerful mission: to put the patient first and to serve as pillars of trust in this community that they call home. Dr. Wall has performed over 6,000 Mohs surgeries and facial reconstructions. He's offered numerous peer-reviewed publications and has been nationally recognized for his research and surgical excellence. But beyond all the accolades, Dr. Wall is a husband, he's a father of 2 boys, he's a compassionate leader, and he's deeply committed to restoring health and confidence through his work. So Dr. Wall, welcome and thank you for joining us on the show.
Yeah, thanks for that intro. I appreciate it. Thanks for having me. Like you said, born and raised in St. Petersburg. So the community means a lot to both my wife and I. I had been gone for a while with schooling and training and working, but we recently moved back and then opened our practice in January of this year. So coming up on about 6 months. It's been going well.
Awesome.
But yeah, happy to be part of the community, happy to be talking with people like you and get the message out there.
Yeah, absolutely. St. Pete, when I first got here, realized, it's all about keeping it local. So the community here is huge and it keeps growing. So I love that.
It does.
So Dr. Wall, tell me kind of what first inspired you to pursue dermatology and specifically your specialty that you're in right now, which is a Mohs surgery. So we can get into that. We can get into what a Mohs surgeon is here in a little bit, but what kind of, was there a defining moment for you, or was there like a mentor or a personal experience that kind of led you down this path?
Yeah, definitely. So growing up, I spent a lot of time with my grandparents, particularly my grandfather would pick me up from school and that kind of stuff. And he was born and raised in Southern California and then was in the Navy and then came to Florida. So he had a long time of sun exposure. So constantly picking me up from school, he'd have bandages on his ears, his face, his nose. And I'd always be like, what's going on? And he said, oh, I went to the dermatologist. They saw skin cancer, removed it. And now, I have this bandage. And I remember being in about 8th grade thinking, they just looked at you, saw it was a skin cancer and removed it. And he's like, yeah. So, I thought that sounded fascinating. So when he went to the next appointment, I went with him. The dermatologist happened to be kind of a family friend. And so he kind of said, why don't you come and start shadowing me on my surgery days? And so starting in about 8th grade through high school, about once a week, I would go work at the dermatology office, helping with surgery and that kind of stuff. And that really inspired me to want to be a dermatologist. Now, did I have any idea what that took? No, I had no idea. I thought you just went to med school, picked what you wanted, you just did it, and that was that. I did not know dermatology statistically is the hardest specialty to get into.
Is it really?
It is. This past year, it had the lowest match rate, which means it's the hardest to get into, about 50%.
Wow.
So half the people that apply for dermatology get in. That's about it. So when I got to med school, my advisors were like, what do you want to do? I said, oh, I want to do dermatology. They said, no, pick something else, at least have a backup plan. But I said, I don't want to do anything else. I looked at everything. I thought about maybe orthopedics or plastic surgery or something like that. But ultimately, it came back to dermatology. And so when I got into dermatology, I thought it was all skin cancer and surgery. And did not realize it was a lot of clinic and rashes and psoriasis and eczema and all the other stuff. And so, that was another learning curve. And then what I did was, so I did a residency. I did an internship, which was 1 year of internal medicine. I did 3 years of dermatology, and then I did a fellowship, which is an extra year of training just in skin cancer surgery. And so, what Mohs surgery is, it's named after Dr. Mohs, who's the guy who invented it.
Okay.
So, he invented this technique at the University of Wisconsin. Basically, it means if you have a cancer, either an
Hmm.
aggressive cancer or located in an area that's cosmetically sensitive or there's not a lot of skin, head and neck, but also hands, feet, genitals. The traditional way to do it was you would cut it out with a big margin, sew it up, send it to the lab. A pathologist would look at it, tell you whether the cancer was out or not. If it was, okay, but if not, you had to go back and do a big surgery again days
Hmm.
later. Well, this kind of combines everything in one. So if you have a cancer, what you do is you come and see me. I identify the cancer, and on the day of surgery, this is all done in my office under local
Okay.
anesthesia.
Cool.
I surgically remove the cancer. I have a lab in my office. So while you're waiting, we process it, and then I check it myself under the microscope, all around and underneath it while you
It's all
wait,
in-house.
all
Wow.
in-house. And
Cool.
so the benefit is, you're waiting there, but also I'm checking 100% of the margin. So when the cancer's out, we know it's gone right then and there. And then with my training, I'm able to do the surgical reconstruction while you're there too. So rather than having to go to the operating room or the hospital or wait multiple days, you get the results that day, you get the surgical reconstruction that day because I'm doing everything. And so
Hmm.
it can be a longer day depending on what the cancer is or where it is. But at the end of the
Yeah.
day, the cancer's gone, you're fixed, already on the road to recovery. And so being fellowship trained, there's only about 2,000 fellowship trained surgeons in the whole country. And so if
Hmm.
you're fellowship trained, you can actually trace your training back to Dr. Mohs. So I was trained in Georgia by a guy who was trained by a guy in California who was trained by Dr. Mohs. And it kind of
Hmm.
goes like that. And so um, skin cancer and prevention and treatment is my niche, my passion, but I do everything. If you have
Yeah.
rashes, eczema, I see kids, I see anything. But if you need my expertise, it's on skin cancer.
Skin cancer. Yeah. And kind of back to kind of what's inspired you. I know you mentioned there's a lot of learning curves there. Was there anything else that you didn't expect as you kind of went through school and didn't done your training and then now just practicing on your own full time? Anything that's kind of surprised you most?
Um, I think what surprised me the most about medicine in general is the residency training and that kind of stuff.
Hmm.
Maybe I was super naive, obviously I was, but I thought you just went to med school, said, I want to be a dermatologist, and then you
Yeah.
graduate and you just go out and you're doing dermatology. But in reality,
Gotcha.
you have to rotate at other places, interview at other places, and then you have something called match day, which is 12 Eastern on a Friday in March. Every
Hmm.
med student in the country opens an envelope, and it basically tells you where you're going to be doing your training at. Um, and so now that's kind of unique. And then
Hmm.
your training is unique because you
Hmm.
train in a super clinical environment, and then depending on what you want to do, so like if you want to do cardiology, well, you
Hmm.
don't just go into cardiology. You have to do internal medicine before you do cardiology. So you have to do
Right.
3 years of internal medicine to get to
Hmm.
cardiology. And so that was something else I wasn't aware of before I was into this, is kind of how long the process is, how involved it is, and also
Hmm.
the places you will go. I did my med school at Louisville in Kentucky. I did my internship at Louisville. I did my dermatology training in Augusta, Georgia. I did my surgical
Hmm.
training in Macon, Georgia. So those were all places I had never been before, and
Yeah.
places I
Yeah.
didn't expect to go. And so everything was an eye opener for sure.
Hmm. Cool. Yeah, that's awesome. So coming back to, I know you're people driven, you're community oriented. So is there, beyond just the skin and everything, is there, or when did you realize that your work perhaps had a deeper meaning for you beyond just kind of the skin stuff and the surgery and all of that?
Yeah, that's a great question. I try to think of everybody that sits in
Hmm.
the chair as either myself or my family member and
Yeah.
what I would want if they were me or
Mhm.
my grandfather, my dad, my mom, my wife. Sometimes that means not having the surgery. I think
Yeah.
you have to look at everybody as a whole. Certain kind of skin cancers can be life altering and life ending. Certain kind of skin cancers might not be. And so if somebody has a host of other medical problems and maybe this surgery would be the thing that tipped them over to a point you don't want them to be, well, maybe surgery is not the option. there's other things that can be done besides surgery. And so I always try to think about that. Even though surgery is my specialty, what would I want? What would I want for my family members? And also what's best for the patient, And then outside of just cancer, our skin, kind of like our gut, is a microbiome. And so skin
Yeah,
health
yeah,
can really be a marker for overall health or vice versa. If you can get your skin healthy, it can help your microbiome, it can help reduce
sure.
infections. We all have yeast and bacteria on our skin, but if you have the wrong kind of bacteria, you can get infections like MRSA if you have staph and that kind of things. And so
Hmm.
skin health can improve your overall health, especially diabetics with lower leg wounds. It's very
Right.
important to keep those under control. And so skin is a marker for everything, and is really the barrier to the outside world. It keeps bad stuff out and good stuff in.
Yep. Yeah, and I think that's good for the listeners to hear too, because you know, just along the same lines as like an orthopedic surgeon, people immediately think that, oh, they're a surgeon, all they're going to want to do is surgery. So it's really good to hear when clinicians or doctors, physicians that are in the specialty of surgery, for them to say, look, we're not looking to do surgery all the time. It's not, a lot of times it's not necessary. So I think that's really important. People do like to hear that, because they can get freaked out when they hear that you're a
Yeah,
surgeon,
I understand.
Oh,
I tell people, I think the worst part about surgery with me is thinking about it, is
hmm,
the anticipation. You're nervous, you've just been diagnosed with a skin cancer. What's going to
yeah,
happen? Usually patients tell me the day of surgery was not as bad as they expected.
hmm,
It's really the anticipation. But what my message is I would prefer not to do surgery on you. I would
yeah,
prefer to never see you again. But if you need me, I am here for you. And
hmm,
if you need my skills and my techniques, I will do the best job I can every time. But I am not looking to do unnecessary or extra surgeries. I prefer not to do surgery. But if we need to, we will do it and we'll do the best job that we can.
hmm, yeah, yeah, definitely. I love that. Um, so, what do you believe in addition to all that? You mentioned just treating each patient like they're your grandma, or your grandpa, or a family member. What else do you believe defines exceptional care, specifically in the realm of dermatology? Anything in particular?
Yeah, I think looking at the patient as a whole,
Yeah.
I think sometimes in whatever specialty you're in, you can become so focused on what your specialty is that we don't look at the whole picture of a patient. Because for example, patients will come in with a new rash all over, and
Mhm.
I'm not sure what caused this. Well, the first thing I do before I even see the patient is I go through their med list, because medications can be a
Mhm.
common cause of rashes. And
Rashes.
so,
Yeah. Yeah.
one of my first questions is any new medicines, any change in health? And sometimes they say yes, and it can be as easy as talking to their primary care doctor or their cardiologist or something, or about, switching a medicine or a simple lifestyle change that can have a huge effect. I think sometimes with the new medicines and the new technology, everybody wants to push the latest and greatest medicine. We see all these psoriasis medicines all over TV, ads about everything, when sometimes simple is better. I think let's start simple. Let's maybe try to eliminate some products that we think are causing this irritation, maybe try to treat it topically. If that doesn't work, we can always escalate, but let's kind of focus on the basics, really
Mm.
simple skincare, especially for children with rashes. Um, I love an old school technique. It's something called a wet wrap, but it's basically where you put your cream on, you put a
Yeah.
damp layer of clothes on, you put a dry layer of clothes on over it, and you go to sleep like that. If you can handle that and you have dry, irritated skin, when you wake up in the morning, it will totally change your skin. It will change the texture, the moisturization, and that
Really?
technique's been around
Yeah.
forever. So I think sometimes we get focused on technology, the latest and greatest, when really getting back to the basics, thinking about people's lifestyle as a whole. What are you coming into
Mhm.
contact with? What are you putting on your skin? What's new? New medicines, new hair dyes, a new shampoo. It can be as simple as that. So rather than, focusing super niche on the symptoms, let's look at
Mhm.
the environment and see if we can fix something without much work.
Yeah. Yeah, I love that. And I think that's definitely been lost in all of healthcare. I didn't even know too much about dermatology being in, the
Yeah,
field of physical medicine, but we're so often quick to escalate, like you said, um, to use the newest and greatest tech that we have. But sometimes you don't need all that. Just stick to the basics. It works. It's
yeah,
tried and
exactly.
true. Yeah. So kind of moving on towards who you treat and what you do. Obviously, you mentioned seeing a lot of skin cancers and psoriasis and rashes and those sorts of things. Are there certain groups of people or patients that you tend to see more often than others?
Sure. So, short answer is I see everybody.
Uh huh.
In a clinic day, I could see a 2 month old and a 100-year old. It varies. So I will see anybody, and I'm comfortable seeing any age group. Typically, I see older adults with
Mm-hmm.
actinic damage or sun damage, either snowbirds that have come down or people that have lived their whole life here.
Yeah.
But it's changing. I'm seeing a lot more younger people that are concerned with their skin health, that are asking about preventative treatments or are starting to notice the signs of aging, sun damage. What can we do to already start treating those? And so, like today, this morning I had a bunch of skin cancer surgeries, but in the afternoon, I had some cosmetic patients and some younger patients that we were working on skin health, preventative treatments, things that can really set the groundwork so that you age gracefully, especially in our climate like Florida, where it's hard to
Yeah.
avoid the sun. Almost, it's impossible to avoid the sun, but if you can do things the right way, you can try to negate the negative effects of it.
Mm-hmm. Awesome. Let's talk about some of the warning signs that you would say. I'm sure you get patients that come to you that they say they wish they would have done a little bit more due diligence in getting something checked out. Is there anything in particular um, that you would say patients shouldn't ignore when it comes to their skin health?
Sure, sure.
Mm-hmm.
So, I tell everybody, if you're worried about something, have it looked at. I would 100 times rather have you come and see me and me tell you it's benign, don't worry about it, than the
Right.
opposite. That's my first thing. But
Mhm.
some signs that you'll see from being out in the sun. You can see changes in pigment. So that means you can get more freckles or more brown spots on your face, things like that. Some more blood vessels, some little red fine lines, some wrinkling. And then eventually your skin will start to turn red and you can get kind of a sandpaper texture. If you look at some older, maybe veterans or people that have been on the beach a long time, they'll have some roughness and some redness on their face,
Yeah.
their arms. That's all sun damage. And then as far as a specific lesion, if it's hurting, if it's changing, if it's bleeding, those are all signs. Melanoma has specific signs, and sometimes they can be hard to tell yourself. It's the
Mm-hmm.
ABCs of melanoma. But basically, it's if you have a new mole, we call it the ugly duckling sign. So if you're super freckly and you have one mole that just kind of stands out, that your eyes are always drawn to it, it doesn't necessarily mean it's bad, but it might be a
Sure.
reason to get looked at.
Mm-hmm.
People that are really moly, really freckly, it is hard to tell subtle differences in your skin. So something I recommend is to get your phone, take a picture of your front, have somebody take a picture of your back. Then every 3 to 6 months, repeat. Because if you compare a picture to a picture, you can definitively say it's different or it's not. What happens a lot of times is people come in and say, my wife looked at my back, she thinks this mole's different. Does she really know? I don't know,
Mm-hmm.
because it's really hard
Mm-hmm.
to tell. But if you have a picture to a picture, you can say, yes,
Yeah,
it's
that's a
different,
good
or
idea.
no, it's not.
Mm-hmm.
And then something that is very common is a wound that won't heal. So someone says, I always shave and this always bleeds. Or I always get a little scab here and I pick it and it heals, but it comes back. And I pick it and
Mm-hmm.
it comes back. So, that can be a warning sign that it's a skin cancer because unhealthy tissue never fully heals. Um,
Mm-hmm.
so all those are signs. And then, sometimes there's no signs and you find
Yeah,
something. But I think my philosophy is if you're worried about it, have somebody look at it.
yeah,
Because I'd rather say, no, don't worry about it, you're totally fine, than the opposite. And then you come in and say, oh, I wish I had come in sooner.
yeah, yeah, definitely. And I think about what you said earlier, the sun damage, and I think about like myself, very fair skinned. So what do you call the little, the darker spots, just the hyperpigmentation?
Yeah, I
Like,
mean, you could call them freckles or lentigines,
yeah.
sunspots.
Okay.
People get melasma when they get pregnant. Women get the brownness on their cheeks.
Yep.
It's from hormones in the sun, you know. Everybody, our left
Yeah.
side is our older side. Why? From driving. We get most all of our sun through the
Ah,
car windows when we drive. So everybody,
yeah.
unless you're like a mail carrier, your left side is your older side. And so it's more
Hmm.
common to get stuff on your left arm, on the left side of your face. So it's just
Interesting.
things to think about. You don't think about driving, but we do it a lot, and that's when you get a lot of sun.
Does it not matter if the window is open? I thought like you couldn't. Can you get sunburnt with the window up? That's actually a legitimate question.
So, you know, what's funny is I actually looked this up the other day. So the newer cars are supposed to have treatment in them that project or protect against like 98% of UV rays.
Mm,
Fine. But I will tell you, you know, drive the whole day on the interstate in shorts or something and let the sun hit your thighs, even through the sun, through the windshield or through your window. You know,
mhm.
it feels hot. You can feel the sun hitting your skin. So you're
Yeah.
definitely getting the effects. You know, I have fishing gloves that I keep in my car and I wear them on my hands because
Yeah.
our hands get a lot of sun, and a part of your body that will age you is your hands. You know, you can have
Mm,
all this work done to your face, your neck, but your hands, especially for women, can give away your age because they're in the
mm.
sun all the time.
That's a good point. Yeah. So are those sunspots, the brown spots, the ones that start with an L? I don't know much what
Yeah,
you said. Are those? Can you fix those? Like, are there things out there that can correct that?
that's a good question. You know, that's one of the most common questions.
Hmm.
Short answer is yes. You know, so there's a lot of different things you can do. Honestly, you know, wearing sunscreen will help lighten them because anything that's dark, every time that you go in the sun, it will make it darker. It just will. That's what the sun wants to do. That's what happens. So
Hmm.
the first thing is sunscreen. If you don't wear sunscreen, you'll never get rid of them. The second thing is there's some lasers that will target brown spots. IPL, which is intense pulse light, or BBL, which is broadband light, are actually exactly what they said. Super bright lights that target
Hmm.
browns and reds, and they can help get rid of these things. But if you don't wear sunscreen, they might come back or you'll get more. So the first thing to do is sun protection. And then there's some cosmetic treatments that you can do, some lasers that will help get rid of them.
Gotcha. Awesome. Now, is there anything that people or often misunderstand about what you do or what your role is as a Mohs surgeon?
I think so. You know, dermatology has been glamorized on
Hmm.
social media and TV. And so when I tell somebody I'm a dermatologist, you know, the first reaction I get is, oh, you do Botox all day and
Yeah.
you're doing facials all day. Which is true. I do a lot of Botox and I love neurotoxins as preventative treatment or treatments like that. But I think people forget about skin cancer, skin health, you know, especially in the sunshine
Mhm.
state. You can't get away
Yeah.
from it. Everybody's going to have sun damage. And so I think people underestimate, and then it's hard to imagine what a skin cancer surgery is like unless you've gone through it or a family member has,
Yeah.
because I think people have a sense of, well, everything I do is in the office, so it must not be that involved.
Hmm.
But if I showed you some of my patients of the surgeries we've done, you know, we're doing big surgeries on ears, noses, lips that can be intense. And so it is a good reminder to wear your sunscreen. You know, because you don't want to come and see me if you don't have to. But at the same time, you know, I do cosmetics and I like neurotoxins, which the
Hmm.
most common brand name is Botox, and things like that. But it is not all I do. You know, there's some real
Hmm.
skin diseases, psoriasis. If you know anybody with
Yeah.
psoriasis, it's a real disease. Eczema
Yeah.
is a real disease. Little kids get all kinds of rashes, hand, foot, and
Hmm.
mouth, things like that. So we deal with all those type of things. It's just the cosmetic side has been glamorized recently, and so that's what people, when they
Yeah.
hear dermatology, that's what they think of.
Yeah. I can see that. Definitely. So, how does dermatologic care, specifically maybe skin cancer treatment or surgically post-op, benefit from like the coordination of with other providers, if any? Maybe it's a primary care or even physical therapy. I don't know
Yeah,
if you've ever seen anything like that. I know
I
you mentioned,
have.
you mentioned that, diabetics, right? They have sensory issues, and so they can develop neuropathy, and of course other um, skin rashes or cuts that don't heal. So, um, have you seen any of that, or what is your experience like with that coordination with other types of providers?
Yeah. So I would say for the most part, I handle everything in-house,
Mhm.
for the most part, 99, 98% of stuff. But I have had instances. I did a very large surgery on a woman's shoulder, and she was kind of having some soreness afterwards. So I sent her to physical therapy
Mm.
um, to really make sure everything was working properly. Because I think sometimes what happens is people have a big surgery, let's say on their arm or on their leg, and then they're afraid to use it. They don't want to mess up the surgery. And so they stop doing their
Yeah.
normal daily live things. And then eventually maybe they get some muscle atrophy or they're just sore. And so I think physical therapy helps one show them, you can do everything. You don't have to totally baby this thing. And it also shows them how to properly do stuff,
Mhm.
lift like this. Here's some exercises you can do at home, which is your expertise. Wound care, I coordinate a lot with wound
Mm.
care, not just for surgeries, but for just regular patients. I see a
Yeah.
lot of handicapped patients that have ulcers, on their backsides or their lower back from sitting all day. And so that's something I treat all the time, but I coordinate with home health a lot
Yeah.
in wound care on how to properly take care of them, how to clean them, what the management should be. So I coordinate with wound care probably the most, home health and wound care. And then primary care offices, I'm in contact with all the time. Basically, I say if you have anything you're worried about, send them to me. But I kind of tell them some of the things to look for. Like I've told you, if somebody has a bump that's hurting, changing,
Mhm.
bleeding, call me. I'll see them whenever I want. Um, Basically I try to be a resource for them. If you
Sure.
are at your primary care and he or she doesn't feel comfortable, call me. I think
Mhm.
I'll see anybody anytime really and kind of manage that. But I would say physical therapy, some mainly wound care and home health is who I work with.
Yeah. That makes sense too. Yeah, we're trained. We take wound care and PT, and there's a lot of PTs that actually do wound care still, which
Okay.
is it's pretty wild. But we learn a little the ABCs of the melanoma and all that. So I
Yeah.
know colleagues, many of them, that have been able to catch something on somebody because we're seeing people all the time. So we have to know what it looks like, or something weird, or something changes because we're with people for a long period of
Yeah.
time, to be able to send to you as well. So it's super important. I don't know how much the general population and the audience knows that, but there's a lot of coordination that is, I would say, supposed to happen between um, many different providers. So it's nice to hear that you do that too.
Yes, yeah, no, I love collaboration.
Hmm.
And I am, I think similar to you, I have no ego, and so I think if somebody is better suited seeing somebody else or needs to get into somebody else, let's do it. I mean, I have
Hmm.
no qualms about sending them to PT
Yeah.
or
Yeah.
wound care or anywhere, neurology, orthopedics, whatever they want. Even if it's not a problem related to skin, if somebody's like, I need to get my knee redone. Do you know any orthopedics? Well, maybe I do, maybe I don't, but I'll do a little research for you and try to send you somewhere that I think's the best, or at least ask around to have an opinion on something. So, because like you said, I think people don't think, but you're seeing parts of their body they never see, the backs of their legs,
Yeah.
their
Yeah.
backs. So, it's great to have a
Hmm.
colleague you can trust and contact if you need something.
Yeah. Yeah. Definitely. So, not to get like graphic or morbid or anything, but what are some consequences that you've seen with people, maybe delaying treatment or seeking treatment, or having something looked at?
Sure. I think I have seen skin cancer be fatal. I have.
Hmm.
A lot of people, melanoma is the scary one. And basically,
Uh,
melanoma is scary because we still don't quite understand melanoma. Why does it
mhm.
spread on some people and not on others? And that's why it's a big research hotbed, which is good. But really, squamous cell carcinoma, which is the second
Yeah.
most common kind of skin cancer, can be aggressive. And I have seen it be aggressive and be fatal on people. There's more rare type of skin cancers. Merkel cell is a very rare skin cancer. It's actually what Jimmy Buffett passed away from. But I've
Really.
had a few patients that have had Merkel cell cancer. So, that's the ultimate consequence. But realistically, the consequence of not seeing me, this is what I tell people, is if you have a skin cancer, it's never going to be smaller than it is right now. A cancer is
That's
not
good.
going to grow smaller. It's only going to
Hmm.
grow bigger. And so if you have it in a place that's very high real estate, your nose, your face, your ear, it is easier for you and easier for me to treat it when it's the absolute smallest that it can
Mm.
be.
Yeah.
Because, some people think they want to wait. It's just a little dot on my nose. I want to wait, which is totally fine. It's your health and your body, and I'm here to respect
Yeah.
whatever you want. But at the same time, it might grow. And
Yeah.
what does that mean? It just means the surgery is going to be more involved than if we did it now. So that's the number one consequence, I think, is
Mhm.
that the cancers get bigger, the surgeries get more involved. Now, with things like melanoma and squamous cell, there is the potential for them to spread other places, even if they're not fatal. There's the potential for them to spread to lymph nodes, which kind of escalates your care. That's when you need to see oncology or maybe radiation oncology or surgical
Mhm.
oncology, which does happen, not
Yeah. Yeah.
infrequently, especially when you're seeing a lot of skin cancer. But the main thing I think is that it gets worse. Something
Yeah.
gets worse, and then when you want to have it treated, the surgery is just a little bit more involved than maybe you thought it was going to be to start.
Yeah. Yeah. Definitely. So in other words, wear your sunscreen, and it doesn't hurt to just go get it checked out. So that
Yeah, yeah. My number
probably
one,
the best.
people ask me, what's your number one recommendation, whether for skin health, skin aging,
Yeah.
cosmetics? The first thing is wear your sunscreen,
Yeah.
period.
Yeah.
You could
Hmm.
have a facelift, you could have Botox, fillers, but if you don't have your skin health, which if we think
Hmm.
about the food pyramid, let's think about the skin pyramid. This could be the base of the skin pyramid is your skin health. Well, that
Hmm.
starts with sun protection. And sunscreen is a very hot topic right now. There's a huge thing about whether sunscreen is good or bad for you, and that's a whole different conversation we could have because I have
Yeah.
opinions on it. But I think ultimately, do your research, whatever you're comfortable with, but in some form or another, you need sun protection, whether that be
Hmm.
clothing, shade,
Yeah.
tinting in your car. If you don't want to go the sunscreen route, there's actually supplements out like HelioCare, which help protect against the sun, and that's a pill that
Oh,
you
that's
take. So,
okay.
there's different routes. If you said I'm totally anti sunscreen, but I would say sun protection is what you need for sure because
Yeah.
it will age you cosmetically and it can cause skin cancer. And so sun
Yep.
protection will be the base of the pyramid. And then if we want to build on top of that, we can, but without the base, you can't build.
Yeah. 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 That's good. That's good advice. Lots of good stuff that I had no idea about.
Yeah,
So love
man.
that. Yeah. So um, to wrap up here, Dr. Wall, where can people find you? What's the best way for someone to get in touch with you to make an appointment?
Sure. You can find us online,
Hmm.
www.wall, W-A-L-L, derm, derm.com. You can make an appointment online. We have a whole system where you
Hmm.
can schedule online, or you can call us 727-606-9255, which spells
Hmm.
out wall on your little keyboard thing. Um, Instagram, Wall Derm. My Instagram is Weston Wall, MD. Yeah, really. We're located on 66th Street, right next to Tyrone Mall. There's the Orlando Health Building on 66th Street. We're right next to it in a big white building there on 66th and 18th.
Hmm.
You'll see the big sign for us. But yeah, call. Like I said, I'll see anybody about anything. So,
Awesome.
even if you have a spot that you're not sure about, come and see me.
Yeah.
We'll do a whole skin exam. We can talk skin health and all that kind of good stuff.
Cool. Very cool. Well, Dr. Wall, thank you so much again for joining the show. It's been amazing learning from you. And I know the audience and anybody that listens is going to learn a ton from you. So thank you.
I appreciate it, man. Thanks for your time.